afternoon to everyone. I'm Dr. Thineshchandar. I'm a consultant orthopedics in Lifeline Hospital. So I just want to discuss about a patient over here who's a 20-year-old boy who's come from Bangladesh, and he had initially come to us with complaints of pain and swelling and difficulty in walking over his right lower limb. So when he came to us, he was already diagnosed to have something called an osteosarcoma, which is a cancer of the bone and of his right thigh. So this diagnosis was done to him initially at the age of 16 years old. That was 4 years back in Mumbai. And to give you a small idea of how rare osteosarcoma is, you only have about 30 people who are affected with osteosarcoma out of 1 crore people. So it's a very rare disease, and it only constitutes for about 2% of all cancers in the world. So it's a very rare, complicated disease, especially involving the bone and the muscle. And as we see him, and when he came to us, he had already been diagnosed to have osteosarcoma 3 times in the past 4 years. So which is extremely rare to occur in this situation. And so talking about Mr. Saiman here is when he was diagnosed to have osteosarcoma initially about 4 years back, he underwent 2 different surgeries. One was for his leg at the age of 16, when he underwent a replacement of the distal part of the thigh, that is your leg part, and the knee joint itself was completely removed, and a metal knee and a metal bone was put inside, so that the whole cancerous bone was completely removed and changed in Mumbai. But he was also diagnosed to also have the same osteosarcoma for a second time in his lungs. So for that also he had underwent a surgery again in Mumbai a year later. So this is the 3rd time when he came to us. This was, he's been suffering with leg pain, and he's feeling a small movement inside the leg for the past 1.5 years. And because of COVID and all these complications and traveling all the way from Bangladesh was very difficult, so he had to live with the pain for a while. But then the 3rd time when he had undergone a biopsy and he found out that he again has the same cancer for the 3rd time, he immediately came and he found out about us, and he had came here for surgery. We had set up a very big team of orthopedic surgeons and plastic surgeons, and at the same time we also discussed with our oncologist and a pathologist and a microbiologist. So we had a full big team so that we can give the best treatment for him. And after discussing with the whole team, we had decided and planned that we'll be operating on him and go ahead with this complicated surgery. So why this is such a complicated surgery is because it's been done again for a second time, and usually for these surgeries they use multiple cements. So removing the cement and doing the surgery the second time is much more complicated than doing it for the first time. And so we had to get all the reports done. Once everything was fine, we went for surgery. The most complicated part of the surgery was inside surgery, when we saw that he had a lot of fluid inside the legs. So it was extremely rare to find so much of fluid inside the leg. That's the reason he had pain and loosening. So the surgery lasted almost 10 hours for us, and we had to go ahead and remove the cancerous area completely, and that area was filled with a flap cover and a skin graft by the plastic surgery team. We had actually used a very specific implant for this patient, which is actually designed in Chennai, where they have to measure the length of the patient, and we had to specifically make it for the patient, which is another thing which is very rarely done for all cases. Maybe I say about 1 case in every 10 lakh cases which we use this kind of a specific implant, which we had to make it specific for the patient. And the other thing is, when the first operation was done, he was 16 years of age. Now because he is 20 years, he has grown in height. So we had to make sure that he gets a very specific implant so that the height of the patient is also increased. So all these were the very big challenges, and we're actually very happy with the results he's come out through. And he also was discharged in a week after surgery. Just hardly in 6 or 7 days he was discharged, and he's gone back to his hotel room, and he's been coming and reviewing us for the past 1 week in our OP setup. And now he's planning to go back home to Bangladesh tomorrow actually. So it's been 14 days since the surgery, and he's pretty happy, and he started walking, and he's on his physiotherapy sessions right now, and he's actually planning to go back home soon so that he has to go and write his first-round exams, which is coming up next week, which he couldn't write for the past 2 years. So he's very happy, and he's been sitting and studying during his surgery time so that he can go and pass his exams as soon as possible. So that's just a small brief about what we had done with the surgery. So yeah, any questions you can just ask. Yes, so this is a solution for now for sorry? Yeah, sorry. So this is right now a permanent solution for the cancer part, but regarding the implants and regarding this thing, we have to wait and see how he is able to walk and how it helps him, because these implants usually last from 5 to 10 years. So if depend upon how he walks and how he takes care of his leg, it will last him for 5 to 10 years a minimum. But some people have come after 15 or 20 years, and when they need to go ahead with a revision surgery. No, actually there's not a mistake, especially done from the Mumbai hospital. We have done the best job which they can, but because of his complication and how severe the cancer is, we feel that the distal part of the muscle which was not properly excised, maybe because it was a very massive expansion of the cancer, that it is very likely that it would have been missed off, and he has regained it after, even with multiple chemotherapy sessions which he's gone through for the lung cancer. He still has a recurrence, which is extremely rare. To have it 3 times in 4 years. They usually come back after 4 or 5 years with the second time, or maybe let's say if 3 times, maybe once in 10 years they might have it. But this is within 4 to 5 years he's been having it for a 3rd time now. So this is extremely rare to see. That all depends from the patient to patient. It's still one, but we made sure that we want to give him the best. So we had got a titanium implant. So titanium is known to be one of the most strongest implants, especially used in orthopedic surgery, because it will last a longer time, and he can start bearing weight much more faster. And it is more stronger than steel or any other biocomponent which is available in the market right now. Titanium is, the studies will show that it is less chance of having infection by using a titanium, and it is more stronger compared to steel when you start bearing weight and you start walking, and it's more lightweight compared to steel also. No, we have 3 companies in India who is doing it, but this company is in Chennai, and they have. So what we do is we initially call the patient, we do a scan, we make sure length is measured, and for this patient especially we had to order it specially made, and after it only they actually make the whole implant. So it's custom made for him. It's called a patient specific implant, PSI implant. So it's specially made only for him. So we can't use the same implant in any other patient, because it's made according to his specifications, according to his leg, according to the size of the leg and the length at the same time. Sorry? The cost of operation depends from patient to patient, because he had to go ahead with 3 different surgeries at the same time in one shot. We are able to reduce the cost down. But usually with these patients, the cost depends from patient to patient, depending on what condition they have. If it's only a bone, if it's also a muscle, if it's only the implant, usually you can have 2 different types of implant. So it all depends upon the patient and the condition. No, it actually starts with the bone in the knee first, and then it went to his lungs. So usually these cancers do not grow that much that goes to any other part. Very rarely these cancers from the bone, it goes to the muscle. For him, he already had from the bone to the muscle in the first stage. The second time when he went, he had the same cancer in the lungs, which is also very rare to have that. And then again having the cancer in the same place again is a very rare possibility to have, especially in these kind of cancers. Now he is fully 100% cancer free. No. From this area, from this site, he doesn't have any signs of recurrence at all. And usually these cancers don't grow after 20 years of age. So we are hoping that he will not have any other growth anywhere else. That's what we are positively looking at right now. He has already started walking without putting his weight. We usually start asking him to put weight after 6 to 8 months, 6 to 8 weeks. So he is coming back after 6 weeks to us from Bangladesh after the exams. And we will start making him put full weight gradually over 3 months. So after 3 months he can start walking without support, and after 6 months he can do all other activities as he used to do previously. the reason there's hardly any studies which shows that it may be genetic factors or it can be any other biological factors which have. So he doesn't have a very significant family history of anything, but these can occur even the first time in any family lineage. So we can't say that it can is because of some thing, but it is very commonly seen in younger adults, say about 14 to 16 years of age, where they have this cancer. Because of the rarity of it, we still don't have that many studies which prove that why this cancer has come. But cancers are cancers. It's a evolving, it's an evolving disease, and we're still learning a lot of things about it.